A proposed resolution for the city comes right after Hamilton County commissioners passed a similar resolution. Cincinnati council members say making racism a public health issue would allow them to focus more in on the issues in the city and in specific neighborhoods.
This resolution, this declaration, is not meant simply to be words on paper.
Councilman P.G. Sittenfeld, along with council members Jan Michelle Lemon Kearney and Wendell Young, want the city to consider racism as a public health crisis.
I think when COVID-19 came, we all paid even more attention. Then we saw that the Black and brown communities were hardest hit.
Changes they'd like to see: expanded prenatal care, greater lead testing, community-based agriculture to alleviate food deserts, and policy reforms.
As long as local governments fail to address those, we will be standing here over and over and over again talking about a pandemic for racism with no cure in sight.
Last week, the Hamilton County Board of Commissioners voted to approve a declaration that racism is a public health crisis for the county. So why declare it for Cincinnati?
We have our own health department, we have our own police department, we have our own building and inspections department. So we need to make sure that we have our own house in order.
Cincinnati Councilman David Mann agrees with the declaration.
The disparities are enormous. There are neighborhoods in our city where a baby born today will live 20 years less than a baby born in an adjoining neighborhood.
In order for this resolution to become permanent, City Council must vote on it. That happens next month. In Cincinnati, Raven Richard, WCPO 9 News.